Hi, welcome to our project about echovirus.
Echovirus is a polyphyletic group of viruses that cause gastrointestinal diseases in humans. It is a positive sense naked RNA virus. Echovirus is transmitted through body, respiratory, and bodily fluids, as well as through fecal matter. The symptoms as shown in the video include headaches, sore throat, mouth sores, skin rashes, diarrhea, and coughing. Echovirus is known to be an airborne pathogen. Someone sneezing on someone in public can transmit echovirus to someone's body. Someone's body's innate immunity first works to prevent the virus from entering the body. The body's first defense barrier is the skin. The tight junction of the epidermis of the skin prevents microorganisms from entering the body. However, if the virus is breathed in by the host, it is able to successfully enter the body. This is where the second barrier defense of the body, mucus, fights against the transmission of the virus. The mucus lining of the respiratory tract stops viruses and other such organisms, as well as particles from traveling further down the body. Once stuck, the viruses are destroyed by macrophages through phagocytosis if the virus is able to escape the mucous membrane and move down to the body. Interferons are a part of the innate immunity. They are inside white blood cells and can do one of three things. When the virus infects the white blood cell that has interferon, the white blood cell can release the interferons to activate the immune cells. Or the cell can release the interferons to signal apoptosis to nearby infected cells. Or finally, the cell can release interferons to signal to neighboring non-infecting cells to hinder protein synthesis and prevent the virus from replicating. The person is infected with the virus and it travels to their arm. There, a mast cell comes in contact with it and the mast cell gets infected. When the mast cell gets infected, it causes the mast cell to release histamine towards the surface of the skin, and there our skin reacts by swelling redness to counter the virus. If the echovirus can successfully escape the body's innate immunity, it is able to replicate as seen in this video. Being a positive sense naked RNA virus, the echovirus uses the host RNA polymerase to replicate its genome. In this way, the virus replicates into multiple new viruses that can spread throughout the body of a host. This can cause more of the virus to spread throughout the body, which could be an issue for someone trying to contain the echovirus within them. After replication, the viruses move further down the gastrointestinal tract to the small intestine. This is where most of the infection is caused. Echovirus targets cells of the small intestine and lyses them, thus destroying them. B cells floating around in the intestine detect the antigens on the surface of the echovirus, and the adaptive immune system realizes that a foreign particle has entered deep within the body. The antigen of the echovirus binds to the antigen binding site of the B cell and then is neutralized and destroyed. The B cell then produces antibodies against the pathogens and turns them into memory B cells like regular plasma cells, which shown in the pink, and B cells shown in the blue. As seen in the video, when the virus is moving down, a unactivated B cell comes in contact with the virus, but it cannot make the immune process because it's unactivated. So a CD4 has to come and activate it, which acts as a helper T cell so that this process can occur. If the echovirus is successful at being spotted by the B cell, then it is able to infect cells of the small intestine. and this is the small intestine lining. The antigen of the virus binds to the MHC of the infected cell, and helper T cells recognize this antigen as foreign and release cytokines. These cytokines activate the cytotoxic T cells that bind to the antigens of the infected small intestine cell and then cause apoptosis of the virus. This is the complete immune response against the virus that allows the virus to die off so that the host cell can live. This is the treatment section. There are no specific medicines or vaccinations available to cure this echovirus because the echovirus infections almost usually clear up on their own. In many people, they just clear up in a number of weeks, like 2 to 3 weeks. However, in cases where the patients may have a weakened immune system, the echovirus can be really harmful to them because they don't have the helper T cells or strong helper T cells to attack the virus or recognize the foreign body of the virus. So the doctors must prescribe an immune system treatment called IVIG. This stands for intravirus immunoglobulin, and this is a compound consisting of antibodies against a virus that is infected into the body of a patient. These antibodies usually from healthy donors that have taken the antibodies from their plasma to help any patient with a weakened immune system fight the echovirus infection, because without this they would most likely die because the echovirus would continue to replicate without being destroyed. This virus can be really common in infants and young children, and at this point for children, they don't have as much as an adaptive immunity as adults do. So these IVIG treatment can actually be really beneficial to children because their immune system is pretty weak. This is the end of the immune
secondary
system,
immune response because of the plasma cells that are produced and the B cells that are produced from the primary response. There are antibodies made so that when someone gets infected again with said echovirus, they would not have to go through the attack of their immune system so strongly. This is because the memory cells are used to the specific antigen of the virus. This is the end of the immune response for echovirus.